Brought to you by IMIC Research. Life can bring many difficult situations. Domestic violence, addictions, poverty, and even sexual abuse by your loved ones. Welcome, Aimee Cabo and The Cure.
Good morning, and thanks for joining us today. I'm your host, Aimee Cabo, and this is The Cure. Our show is available live through our app called The Cure, our website, godisthecure.com, or Roku, look for The Cure. Also on the Android TV under The Cure. Later on, the show will be aired on Sirius XM Channel 131, the Family Channel, Sundays at 5 p.m., or as a podcast. We created this show as a safe space and how to show that there is hope after going through difficulties if you're suffering or challenged in any way, no matter what type. I'm trying to use testimonies to the effect and inviting professionals and speakers that can help with suggestions. As a survivor, I hope to inspire others, encourage transparency, and find strength in knowing that those who suffer are not alone, and most importantly, those that heal against insurmountable odds do exist. I'm also joined by Dr. Nikolov, my partner in work and in life.
Hi. Hi, everybody.
And today we're going to talk about how to help our children distinguish between curable reasons for ADHD. And we have a special guest that can help us with that, because how often do we suffer, oh, my child has ADHD, my child cannot concentrate, and many other things that we do worry about our children. And Dr. Michelle Addison can really help us with these answers. She works with Dr. John Addison, a family dentist in Miami, Florida, implementing advanced therapies and technologies in their practice. And Dr. Addison's dental practice is gold certified by the Eco Dentistry Association, and Dr. Addison specializes in dental services that treat sleep apnea in cooperation with patients' primary care physicians. And Michelle Addison is the director of the Florida Dental Sleep Center. Michelle, thank you for joining us. Welcome.
Thank you. It's a pleasure.
Michelle, there is so much more to dentistry lately that I wanted to talk to you about. Let's start with the South Florida Dental Sleep Center. Can you tell us a little bit about that?
Of course. So South Florida Dental Sleep Center is actually the only practice that's dedicated to treating sleep apnea and sleep disorders in adults and children using custom-made dental devices.
Excellent. And some of the things that concerns us all is the health of our kids. There are some symptoms that the kids can present linked to your work, such as under eye circles, forward posture, shortened upper lip, overjet, mouth breathing, and recessed chin. What do those things mean? How can we recognize it? And what does it lead to?
Okay, yes, there are many symptoms that we can see in children that sometimes parents have gotten used to just seeing their children this way and don't realize that they are actually symptoms of sleep disordered breathing. Sometimes kids will have chapped lips, or they'll have under eye circles, like you mentioned, or they'll put their head a little bit forward and you'll see that neck going a little bit forward. All those are symptoms of kids that have constricted airways that is affecting how they're breathing and is therefore affecting how they're sleeping. So you're seeing under eye circles because kids are tired, they're not getting the proper air while they're sleeping, and they're not breathing properly. You're also seeing things like chapped lips, frequent throat infections. You see a lot of kids nowadays that have to have their tonsils and adenoids removed. This is because kids are trying to breathe through their mouth while they're sleeping many times, because they're not getting proper air when they're trying to breathe through their noses. So these are all symptoms that can point to the fact that children are not properly breathing while they're sleeping.
Well, I suppose if a child's not sleeping right, it's going to affect their mood. They might be a little bit irritable. And with these throat infections, I know working in the medical field that they can lead to ear infections. And sometimes, like you said, we see chapped lips and we don't think anything of it. A throat infection, we think that the kid's getting constant throat and ear infections, and we're really treating the symptom but not the source.
Definitely.
And So we have to look at where it's coming from, and it's not necessarily that the kid's immune system is low, but the kid may not be sleeping right. And from what I'm hearing, you can tell these things by these symptoms. If you see your child breathing with the mouth open, I know my daughter has a little bit of a recessed chin, but that's because she's got 3Q29 microdeletion syndrome, which gives her a pixie face look.
Right.
But these things, I mean, even I didn't know under eye circles. I mean, I know that that's a problem with sleeping, but that can lead to these things too. And when you're talking about forward posture, it's not so much the back, but the head is forward a little bit.
Right, the head slightly inclined forward, which you'll see a lot of younger kids. When you're at the grocery store standing in line, or you're looking at your own children, you'll see people will have their heads slightly forward and their neck is a little bit down. When you make that posture, that opens up your airway. So that is a way of getting better oxygen that's done subconsciously when these airways are constricted.
So the person's trying to get oxygen, and it's something that we wouldn't even realize or notice.
Right.
And the upper lip overjet obviously is just the upper lip being extending a little bit further than the bottom lip.
Well, yes, and the issue what's causing that is because when you have this mouth breathing both at night and during the day, it will affect the growth of the jaw. So you will see a narrower jaw, and the palate will be very high. Up where you place your tongue will become higher and higher, and that will lead to crowded and crooked teeth. That will then affect the way the lips look. So it is affecting the way these kids are developing, and that is a big focus for us, because we want their jaws to develop properly, not so much to straighten their teeth like happens later with braces, but to really help their jaw develop so that their airway is not constricted as they become adults.
And that is so important, because these things I didn't know, and I suppose other people don't know also. So if you're looking at these things with your child, then it's the best thing to do is take them to the dentist and look into if these are one of the things that are causing the problem first. Right? Am I getting that right?
That would be a good way to screen. We see so many children that, their parents will bring them in and they have swollen tonsils and adenoids, and they also have ADHD. Well, the first thing we want to look at is, do they have sleep disordered breathing? Because that may be the reason that they're mouth breathing, which is causing the tonsil and adenoid problem, and that they're unable to focus because they're tired. So if we can get to the root of what's causing it, half of the kids that are diagnosed with ADHD actually may have sleep disordered breathing, they're finding now.
And once the sleep disordered breathing is corrected, what is the success rate where their symptoms disappear?
They will completely grow out of it, because what we're doing is we're helping their jaw develop properly. So this treatment that we do is as the child grows until their jaw is developed. And it's just custom-made mouth guards that they're sleeping with, but it's guiding the proper growth, which means that the airway will be completely open. It will not get constricted by the narrowing of the jaw and all of the other developmental issues that will follow if it's not corrected.
Yes, and you need proper oxygen for your brain to work properly, obviously, and these things are very important, especially early recognition and prevention, so that it doesn't cause problems later on. For those that are tuning in, I'm your host, Aimee Cabo, and you're listening to The Cure. This show is focusing on diseases in children and adults that can be treated by your dentist. We're joined by Michelle Addison. Michelle, it's wonderful that you are the director of this, and you do help with these things, because it's so common in today's world that so many kids are diagnosed with ADD and ADHD, and it can't possibly be true that so many kids have that. So it makes sense that it could just be a simple thing of making sure they sleep right, if they need some kind of device to help them, and they need to be looked at. And so these are the things that we need to really focus on, so that we can be better parents and assess the situation better, so that we can all go about normal lives. But for example, Boris, he's from Bulgaria. And I know that the dental practices are very different there. And your brother, doesn't he have a recessed chin?
Okay.
Is that why he has teeth in his gums?
I don't know. To take him to Dr. Addison when he comes to visit.
I'm curious.
Maybe we'll do that. That's a great idea. But anyway, that comes to show that the family is so important. Like, for example, today, Michelle is representing the whole family practice of Dr. Addison. The better half. Family, right?
That's true.
That's how it is. But anyway, so Michelle, can you tell us the website if people want to look it up and then make an appointment?
Sure. Our website is www.sfd, like S as in Sam, F as in Florida, South Florida, Dental D, SC.com, and it's for South Florida Dental Sleep Center if you want to Google it. That will take you to our sleep site. We have a separate dental website, which is www.addison-dental.com.
Also, you can Google Dr. John Addison and he pops up right over. Great. So let's continue with the conversation about sleep.
I wanted to ask you about mouth breathing and sneering that they're supposed to be commonly associated with SPD, sleep disorder.
Wow.
Yes.
Yes, the mouth breathing is very important because we're truly meant to breathe through our nose. So when we breathe through our nose, we're getting warm, humidified air that's rich in nitric oxide, which is important for overall health. Yeah. But when you're breathing through the mouth, you're getting cool, dry, unfiltered air. So that is affecting the way the tonsils and adenoids are going to be as far as health, because when they're getting that unfiltered air, they're going to swell, become enlarged, and what that does is that closes up the airway even more. So now the kids already had a constricted airway, started mouth breathing, now their tonsils and adenoids swell, and now they can get even less oxygen. And once they're mouth breathing, it's also keeping their tongue from being in the right place, which means that their jaw isn't growing properly, and also their muscles that they use to speak and swallow and chew are not developing properly. So over time, we're getting kids that are tired, that it's in school maybe not functioning as well. We see lower science and math grades. We see lower overall IQ scores when kids aren't sleeping properly, speech delays, all of these things that then affect how these kids go through their overall schooling, because if this is undiagnosed, it's going to affect them as they apply to college, it's going to affect them later in life. So really important that we get a handle on it as young as possible.
Yeah, but do you get also referrals from primary care physicians or the pediatricians? Because they will be the first people that should see something like that instead of prescribe Vyvanse.
We do. We get prescriptions from primary care doctors, from ENTs, from speech pathologists, some psychologists. So we're getting more and more.
Right.
At the same time, we are having to educate a lot of professionals, because we tend to know about these studies before they do, because it's coming right to us.
Well, it's very nice that we talk about it on the show.
Well, this mouth breathing and snoring is pretty significant, because I see that 9 out of 10 children have one or more symptoms of the sleep disorder breathing.
Wow.
And 60% of us...
Did you say 9 out of 10?
9 out of 10 children have one or more symptoms of the sleep disorder
This
breathing.
is 90%, wow.
And of a study, 60% of the sample had 4 or more symptoms.
Wow.
And also, between the age of 4 and 12, between the ages of 4 and 12, 92.6 symptoms did not self-correct, while 30% worsening with age. Can you tell us a little bit about that? Because I didn't know mouth breathing and snoring was so important.
Yeah.
They are very important, and snoring is already a sign that somebody is not getting proper oxygen intake. So that's already a sign of sleep disordered breathing as soon as you hear snoring. No child should snore. So we often have parents come in and they think that the snoring is something cute that their child's doing, but in reality, no child should be snoring.
How about adults? Can adults snore?
No, I mean, really no one should be snoring.
That's good.
Either way, it's restricted air breathing, isn't it?
It is, and you know, it should not be considered something normal. So any child snoring should definitely be evaluated. Looking at all of these different, you know, symptoms that they have, grinding of teeth is also something that parents will sometimes bring their children in because they notice they're grinding their teeth. Grinding their teeth means that the child is trying to move their bottom jaw forward while they're sleeping to open up their airway, because when your bottom jaw is pulled forward, that opens up your airway. They do that repeatedly throughout the night, and that makes that noise that would alert you that your child is grinding his or her teeth. That's why it's happening. So all of these are things that happen while a child's sleeping that are signals that something needs to be done, that an evaluation should take place.
Excellent. We're joined by Michelle Addison. I'm your host, Aimee Cabo, and you're listening to The Cure. We'll return shortly. This is Moonlight Breakfast by Summer.
Summer nights keeping me up.
Why can't I see the Cure part?
So like curious, care about the pain and the furious. When you future that's priceless, this checklist, this checklist. Take me far away, to this nice place. Can't leave, I just wanna be.
The issue is not stay there, but to overcome all obstacles and show that with the love of God, your husband, and your family, you can succeed. Love is the answer, God is the cure, reveals from a very sincere and honest position Aimee Cabo's life, a warrior who didn't give up and achieved the dream of her life. You can get to know more about her and her story on www.godisthecure.com or buying her book on Amazon.com.
If you suffer from persistent depression, call Neurosciences Medical Clinic to schedule a free consultation for new effective FDA-approved treatments such as intranasal ketamine or Neurostar TMS, a no-medication treatment. Neurosciences Medical Clinic. Call now, 786-600-7005. Neurosciences Medical Clinic, 786-600-7005, 786-600-7005.
And now we continue with Aimee Cabo and The Cure on 880 The Biz.
Welcome back to the show. For those that are just tuning in, I'm your host, Aimee Cabo, and this is The Cure. If this is your first time tuning in, today we're joined by Michelle Addison, and we're talking about how to help our children early dental preventative care and proper sleep patterns. Michelle, I found something very interesting that you had sent me. I wanted to talk a little bit more about compromised airways because it says that when you receive less oxygen in the brain, there's an inability to flush out unhealthy plaque from the brain. And this could be responsible for unhealthy plaque buildup that leads to dementia and Alzheimer's later on in life. Can you expand on that?
Yes, more and more studies are actually being released that are showing that sleep is very crucial to getting rid of these plaque deposits. So when we have children that are already having sleep disordered breathing and already unable to flush out this plaque buildup, we are seeing now studies coming out showing that it is a cause of Alzheimer's and dementia over time. Which is even more reason why we want to address this as early as possible, because if we can correct the way that the jaw is growing and have it develop properly and have the airway not be constricted, then we're going to have adults that are not dealing with sleep apnea because of obstruction of the airway, which is what is then very difficult to treat because we're either going to have to use a CPAP machine or a dental device or a combination of both, and we're not going to have the same effectiveness as we would if we just had the jaw developed properly initially so that the airway is not constricted in the first place.
And that's just it. It's a matter of education, because if people only knew that this could lead to dementia and Alzheimer's, and not only that, but the problem with mouth breathing patterns, it could affect normal, proper function of the tongue and orificial muscles, and it could also deal with speaking and swallowing and chewing.
Definitely. There are so many ramifications that really can be addressed early and can give kids the best chance of succeeding not only in school but later in life as far as their health is concerned.
And also adults then.
Of course. Yes, we always say to parents we would rather be treating them as children than have them here as an adult trying to correct sleep apnea.
I've demented.
How many of us overlook snoring or we don't think it's a big deal, but it's not painful. I don't know, I sleep really deep. But we don't pay attention to it because it's not painful, and we don't know about the ramifications later. That's why it's important. There's people like you, Michelle. Thank you for you.
Well, thank you guys for having me on here, but it really is ignored, and it's often, a way to joke around. You see it on sitcoms on TV, the husband being thrown out of the bedroom because he's snoring, and it's made more of a joke. But really, sleep apnea for adults is sleep disordered breathing that has gone uncorrected. And so that has ramifications. It's implicated in diabetes, higher rates of Alzheimer's, different kinds of kidney diseases, and the list goes on, high blood pressure, heart disease. So really, when we're treating this for kids, we're not only treating it for what we're seeing at the moment, which is having them be able to concentrate better at school, and having them be able to, if they're wetting the bed, stop wetting the bed, or, so many different things, but also when they become adults to not have higher risk factors for all these other diseases.
Wow, and I understand, these things. Now, can you tell me, how does crooked teeth come into play?
Well, because crooked teeth is now a sign that the jaw has not developed properly. So it's starting to develop too narrow. And so you have the teeth not having enough space to grow in when the adult teeth are coming in. And so now you'll see, for example, many of the kids around us will be 8 years old and they're doing pre-orthodontics. So they have braces very young, and then they take them off and have braces again later. And what that's doing is the braces initially are trying to open up the palate, up where the tongue rests, to try and give more room for these teeth to come in. Now the problem is, by the time you're doing that, already the jaw didn't develop properly. So we want to get to this as early as possible so that we can guide the jaw to develop properly. Then we don't need to expand those palates. We don't need any orthodontia because the teeth are going to come in their right places and they're going to come in straight.
Speaking about getting to this early, what are your thoughts about bottle feeding, pacifier, and thumb sucking? What are your recommendations?
Well, when kids are bottle feeding, thumb sucking, or using a pacifier, that's going to increase the chance that the palate is higher because it's making an indentation up in the palate that normally would not be there if they were breastfeeding, which does not create that. So when you do have, prolonged use of the pacifier, like we see a lot of kids now walking around and they're toddlers using that, or they're still drinking in a bottle when they're 2 and 3 years old, that's all contributing to the palate not developing properly. Same thing for a soft diet. Now kids eat a lot of the little pouches, or they eat the little puffs that will melt in their mouth. It's not encouraging the proper chewing motion that kids used to have when they would eat harder foods, and so that is causing all of the jaw to develop in a different way.
Right, I understand what you're saying, and they don't recommend more than 6 months of bottle feeding or pacifier or thumb sucking. Is that the same when it comes to breastfeeding? Because I breastfed my daughter for 2 years.
No, so breastfeeding has no impact because the breast, when it's in the baby's mouth, is not having that same indent pattern into the palate that's something that's not natural is going to be having. So the pacifier we don't recommend longer than 6 months. We recommend that bottle feeding usually ends around 6 to 8 months. 6 is better if you can switch over to a sippy cup, and then trying to introduce foods that are going to have baby chewing versus foods that are going to be so soft.
Oh, God is really smart. I guess best is best. But a funny thing that I also saw is that studies show that half of the kids that are diagnosed with ADD and ADHD actually suffer from this sleep disorder breathing that we're speaking about.
Right. We recommend that any child really that's been diagnosed with ADHD undergo a sleep study. It's really important to really understand how they're sleeping and if they're getting quality sleep, if they're getting into REM sleep. We really need to see what percentage of their sleep is divided between light, deep, and REM, how many times they're waking up during the night.
Isn't that a little bit more complicated? Isn't it much easier to just take them to the dentist, like to Dr. John Addison?
Well, we do the sleep studies.
Oh, you do a sleep study?
We do, and they can do them at home. They don't.
Oh, it's one of these machines that you give them attached to the head?
No, we have different machines now, so they're very simple to use, and you can use them in the comfort of your own bed.
Oh, okay, well, no.
We show all the patients how to use it, whether it be kids or adults, and we will have we'll run the machine when it comes in, see exactly what the results are. It's read by a board-certified sleep physician, and then we have a diagnosis that we can present the patient.
And it's very important because the long-term effects of sleep disorder, the sleep disorder breathing in regards to ADD and ADHD is that 50% are held back 1 grade and 30% are held back 2 grades. So
it is very important. It does have a long-term effect on their IQ. IQ with sleep disordered breathing can go down by 10 to 20 points, which can make a difference. And it's actually valued at something like $170,000 over a lifetime of a child in what's then when they start working, what they're able to achieve career-wise based on, the holdbacks that they had when they were in school and everything else. So we do try as much as possible if a parent has gotten an ADHD diagnosis to get the sleep study done. And sometimes we do have to do, an in-lab sleep study because there may be other things that we're concerned about. And if that's the case, we work with a lot of specialists and we're able to refer patients to them and work together to get them treated. So it is something that we very much recommend if there is an ADHD diagnosis out there.
excellent. That's great to hear. For those that are just tuning in, I'm your host, Aimee Cabo, and this is Secure. You can listen to us live every Friday at 2 p.m. on the radio, or a podcast, or again on Sunday at 5 on Sirius XM Channel 131.
Or through your app, The Cure.
Right. This is Knocking on Your Door by AOR.
I did that right.
Before I know so long, 1,000 miles to soar, 100,000,000 angels to fly by me. Oh please carry me through the night, 'cause I gotta do not a minute more. I need a miracle. I gotta let you know that you're not alone, so I'm coming home. Wake up, I'm gonna be there. Wake up, I'm gonna be there. I'm all the way, and time is my enemy. Wake up, I'm gonna be there. Wake up, I'm gonna be there. Mountains aside, these walls will fall while you sleep through the night, 'cause I gotta do not a minute more. I need a miracle. I gotta let you know that you're not alone, so I'm coming home. Yeah, who's knocking at your door? It's me coming back from home. Wake up, I'm gonna be there. 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 On my way, and you know I couldn't wait another day to see your face. Baby, now I'm on my way. Believe me when you hear me say, I'm on my way. Who's knocking at your door? It's me coming back from home. When you wake up, I'm gonna be there. When you wake up, I'm gonna be there.
Life can bring many difficult situations: domestic violence, addictions, poverty, and even sexual abuse by your loved ones. The issue is not stay there, but to overcome all obstacles and show that with the love of God, your husband, and your family, you can succeed. Love is the answer, God is the cure, reveals from a very sincere and honest position Aimee Cabo's life, a warrior who didn't give up and achieved the dream of her life. You can get to know more about her and her story on www.godisthecure.com or buying her book on Amazon.com.
If you suffer from persistent depression, call Neurosciences Medical Clinic to schedule a free consultation for new effective FDA-approved treatments such as intranasal ketamine or NeuroStar TMS, a no-medication treatment. Neurosciences Medical Clinic. Call now, 786-600-7005. Neurosciences Medical Clinic, 786-600-7005, 786-600-7005.
And now we continue with Aimee Cabo and The Cure on 880 The Biz.
We're back. Thanks for tuning in. This is The Cure with your host, Aimee Cabo. We're live every Friday at 2 p.m. and on AimeeCabo.com. And our call-in number is 305-541-2350. Again, that's 305-541-2350. Please call if your child has been wrongly diagnosed with ADHD. We'd like to hear from you. We're joined by Michelle Addison, the director of the South Florida Sleep Center. Michelle, thank you for staying with us, Michelle. I wanted to ask you, once you know there is a diagnosis of ADHD or ADD, and let's say you bring the child or the person goes to the dentist, I wanted to know if these sleep disorders could be corrected without medications, or is there instances where medication is needed?
Well, we begin treatment with a system called Healthy Start.
Oh, that was my next question. Great.
So Dr. Addison is a certified Healthy Start provider, and so what that is a series of habit correctors and custom-made little mouth guards that are placed in the child's mouth while they're sleeping. Sometimes when they're younger, we do have them put it in like maybe an hour during the day while they're coloring or watching TV, just to get used to it. All the appliances are BPA-free, they're phthalate-free, they have no latex, no silicone, so they are very safe. And what we do is this is a process that takes several years, so we're doing this while the child is growing to promote proper growth of the jaw. So the child will sleep with these devices, and as they outgrow them, we will change them out, and different ones have different functions until their jaw is developed to a point where we know that, the airway will not be constricted, and the teeth will grow in properly, and the jaw has now developed properly. So as far as cost, because I know that that's something parents always want to know, this is about the same cost as it would be to get braces. However, the difference is that we're not only straightening the teeth, we're making sure that the jaw develops properly, which will lead to straight teeth, but also making sure that the airway develops properly so that we're giving the child the optimal chance for health.
And more or less, how long is the treatment process, or it depends on the severity on each individual case?
It depends on the child, but really, we can start as little as 2 years old, so we can see signs already in certain kids that, they're having, teeth grinding or certain other behavioral issues, so we can start as early as 2. We will usually go up until about 12 years old, because that will show that now we have developed the jaw properly and that this child will be set up for success. We can start, honestly, our daughter started when she was 8 years old, because that's really when we had become certified and really understood this process, which has been very slow in coming to Miami and to Florida, but overall there's 4 million cases that have been done with Healthy Start.
But why is it slow to come? Is it FDA regulated? Did FDA approved?
Awareness. There's no enough awareness, I think.
It's not enough awareness, exactly. So if you were up in Boston or you were in Chicago, there are many practitioners doing this for children every day. But here, there has been a lack of awareness and a lack of practitioners becoming certified to offer this treatment. And so, unfortunately, that means that kids just haven't been exposed to the possibility of taking advantage of it.
And it's
I mean, this has been around for over 51 years, so it's not new. It is just new in really the medical community also accepting it as a treatment.
Yeah, probably that's the major problem, right? That regular doctors are not so much interested in doing it because, I don't know why. Why?
regulatory, I don't know.
Well, for one, I think that, it's just better known to doctors that there are certain medications that address these symptoms, and it just seems like, well, we should give the medication that
let's make the kids zombies. That's very good. You know that they even give those these advertisement materials to Michelle when I was in her school, when she was in public school. Our daughter, first grade, comes home with a pamphlet of ADHD medication. I'm not going to even say her name, so don't promote it. But that's ridiculous.
Right, and unfortunately, that's just what's more well known, and even parents, when they think about their child being diagnosed with ADD or ADHD, that's really the only thing that they've usually heard people talking about, is that their kids have been on meds for ADD or ADHD, and it has become so common. It's almost like these kids are taking vitamins in the morning, they take their vitamin and their ADHD medication. So it's just nice for those parents. There's people that the medicines may work for them and they are happy having their children on them, but this is really for those parents that are wondering if there's something else that maybe they could do because they don't necessarily want their kids on medication, or even if they do need to have medication, want to at least try and see if there's, sleep disordered breathing might be a reason and not ADHD. And so this really just gives another avenue to explore that could maybe mean treating these children without having them to be on medication so young.
Yes, absolutely.
Well, it's almost common practice. I hear so much of kids that are ADHD and ADD like that. When did kids stop being normal kids? Why does just being a little bit hyper become ADHD or ADD? I think it's overused.
It is.
And also, it's a lack of education, because I did not know my kid sleeping with the mouth open, it may be a problem. Or if my kid's snoring, I didn't even know you could take your kid to the dentist at 2 years old. So my parents are doctors, and they had a friend who was a dentist, and he would come over and open your mouth, everything is good. That's it. We never went to the dentist. You are 9 kids. Thank God nothing, we didn't have all teeth fall out, but...
No, and that's what we do. That's part of what we do. We go visit with physicians, pediatricians, and we sit down and we have lunch with them, and we go over all of these studies and explain everything to them, and really just try to increase awareness, because it would be nice to have, on the form the pediatrician gives you when you bring your child in for a physical, to be asked if your child snores.
Sure, I'm going to speak to our pediatrician. Dr. Yosen, are you listening? Dr. Yosen, if you're listening, let's see if we can speak tomorrow and discuss that.
Yes, but it would be nice just to give parents the opportunity to think about whether your child is exhibiting these symptoms and if there's something that you'd like to do to address it.
It's so much better to go the natural way and try to correct something as less invasive as possible, because medications, they have side effects. So if it's something as easy as just training or correcting something over time, that would be more ideal. So if I were to have a child that has ADHD or ADD or concentration problems or behavior problems, I think I'm going to look at those first, because I know that I'm guilty of it. Sometimes as parents, we don't really see when our kid is going to sleep. Are they on the phone?
They're like yesterday.
Sometimes we fall asleep before they do.
I did yesterday, yes. We fell asleep.
But we don't know how much it's harming our kids. They don't know better. They don't know they need adequate sleep. And, all this has been so very informative, Michelle, because now I'm definitely going to be a parent that make sure her child goes to sleep at a normal time.
Right, that's definitely a first step, making sure they're getting good, adequate sleep. And even if it's not a behavioral issue, it's not ADHD, there are so many other symptoms that, we can look at. Even the issue of crooked teeth, that kids have all the time. You see crooked teeth in kids all the time. Just seeing it more as it's not a cosmetic issue as much as it is an issue that the jaw is underdeveloped, and that's why we're having this issue, and that's affecting the airway, and we need to look at how those teeth that are crowded are really a sign of something bigger going on with that child's body. And so that's really what we want to have parents focus on. If you're going to put braces on your child, think about, well, yes, the teeth are coming in crooked, but what's happening with my child's health overall? And that's really what we want to get to and want to try to help children really have better health.
That is amazing. That is so great that you said that, because there's so many kids that get braces and they just think, oh, that's what it is. Kids, when they're kids, they get braces, but they don't understand that there's an underlying problem that can be causing those crooked teeth. It doesn't just have to be genetics, that you just happen to have bad teeth. It could be that there's a misalignment of something and it's compromising your airway. And wow, that's amazing, because I know my sister, all 3 of her boys got braces. I wonder if one of them had this sleep disorder.
Yeah.
Yeah, and I mean, they really won't outgrow it, so over time they'll know. We get patients coming in their young 20s, that are snoring and have realized it or had other people tell them, and so once they go through the sleep study and we can see that, now they have obstructive sleep apnea, which means the airway is collapsing while they're sleeping, and it's due to, all these factors that weren't properly cared for when they were kids, more because nobody knew, so we can't really blame the parents in that respect. Nobody was really aware to do anything about it.
It's true. That is true. I grind my teeth at night. I know I was supposed to get something for it, but I think that's why I wake up a few times in the middle of the night.
Oh, so you need what?
Is that what happened to me?
I think you need a sleep study. You need a sleep study. There you go.
I need it. How funny.
You do? So the kid. But that's fine too.
It's never too late to do
Never too late, and it's always going to help you, because those little awakenings, you don't even know. People will do their sleep study, and they'll have had 40 micro-awakenings. I mean, they're seconds. You don't even know that you're awake, but what that's doing is that's kicking you out of your deep sleep and your REM sleep, which is where you need to be, because the REM sleep is where you're really getting good restorative sleep. That's where you're cementing your short-term memory. So if you find yourself often saying, where are my keys? There's a chance that you may not be getting that really good restorative sleep, and so that's really important for your health overall over time.
I knew it. I'm not ADD.
There you go. Okay. That's okay. I'm going to tell you psychiatrist.
Oh, goodness. That is just amazing, Michelle. And I have to tell you, this is all available at Dr. Addison's dental office, which, by the way, he's an excellent dentist. I have to admit, we found out about Dr. Addison because he found out about us when my daughter was almost killed on Valentine's 2016. Her mouth was broken and her teeth were broken, and this wonderful dentist contacted us and fixed her teeth just out of the kindness of his heart, charging us nothing just because he cared. And let me tell you something, in today's world, that is super hard to find. But it just shows there's still good people. Michelle, it's been a pleasure.
Thank you guys for having me on. I really appreciate you.
And I loved having you. It's been great, and thank you so much. It's really great what you're doing. Such a great service to society. I really appreciate you.
Thank you.
Well, guys, it's come to the end of another show. It's hard to believe. It's been wonderful spending time with you guys. And now I'll be leaving you with the wonderful song, Miss You, by Louis Tomlinson.
Is it my imagination? Is it something that I'm taking? all the smiles that I'm faking. Everything is great, everything is looking every weekend. Staring at the stars on the ceiling.